Good morning, everybody, and welcome to the ASC Care Network. Today, we're having a family meeting with some EDs from within our organization. Today, I'll ask each of them to introduce themselves, starting with Leslie.
Hi, my name is Leslie Anderson. I'm the Executive Director at Danville Regional Rehab.
Brandon.
My name is Brandon Burns. I'm the Executive Director at Cypress Grove in Newburgh, Indiana.
Richie.
I'm Richie Barton, Executive Director at Lake Point Village in Scottsburg, Indiana.
And last but not least, Katie.
Hello, I'm Katie Northington. I'm the Executive Director at Vets Nursing Home in Auburn, Indiana.
All right, well, thank you all. Just for the audience members, I asked these leaders if they wouldn't mind jumping on this call today. And I just had a couple of questions, and we'll wrap this up in about 10 to 12 minutes. So first of all, I'm starting with Leslie. What has been your biggest challenge through the pandemic?
It's definitely been staffing for us at Danville Regional Rehab.
Okay, and so for all those competitors or other folks who may see this on social media, that's a staffing concern for every single community across the United States. Brandon, what has been your biggest challenge or challenges?
I would say just fighting burnout and keeping everybody bought into all the policy changes that we've gone through, which seems like a million in the last couple of years. So I think that's been our biggest challenge, is keeping everybody engaged and bought into everything that's going on.
For those outside the industry, every week we have a meeting and we review policy changes that have come from our regulators. And it's just been nonstop week after week, but we always tackle it. But the emotional component is what Brandon is referring. Well, the emotional component kind of captures what you're speaking to. Katie, what has been yours?
Certainly, I echo Leslie and Brandon, but also the uncertainty that has been had with the vaccination requirement. So my staff that are choosing not to get the vaccine are really struggling with a decision that can impact their entire career that they've dedicated their lives to.
Wow. We're going to come right back to that comment. Richie, what's keeping you up at night, or what's been your biggest challenge?
Through the whole thing has been the anxiety, testing the unvaccinated, testing our outbreak status when it becomes somebody test positive. So it's been the emotional part of that, and the anxiety goes along with that.
Okay. So, I have friends and family members who are asked and they'll say, oh, so your company is mandating. And I have to tell them very quickly, no, our regulatory CMS, the folks who basically cover for the care of the residents in which we serve, and they regulate our industry, they've given us some dates that said, if you aren't vaccinated, you can't work in this space. And that's a very challenging request. And so what we wanted to do today is take the power back. Like, CMS doesn't dictate what we do as individual leaders. We have a mission in front of us. And so right now, as leaders, everyone listening to this, regardless of your stance, we know there's an alarm at the gate in regards to what's next for us. So Katie, you had mentioned some thoughts around staff and vaccination. And for those, before I let you answer, for those listening, this isn't a please vaccinate message. We're asking folks to prayerfully consider and to even reconsider if you've said no. And at the end of the day, if your answer is still no, there is no hard feelings whatsoever. So Katie, let me turn that over to you.
Yeah, so I have some staff that have chosen that this isn't the right option for them to choose to be vaccinated, and thus far have been able to comply with the additional requirements that they have versus those that have chosen to be vaccinated. But a hard deadline is coming up quickly, and they're really having a hard time with potentially losing the career and leaving the medical space completely. And these are great, compassionate caregivers, nurses, CNAs, housekeepers, the whole gamut of staff. So it's just been really challenging to look at this outside of being an administrator and as a human, really trying to understand their decision process and how hard of a decision this is for them, and just really encouraging them to please stay in healthcare because we need them. We really do.
That's a very urgent statement. We need our professionals to remain in this industry. Think of the seasoning that has occurred through this pandemic. It's made us better leaders, better servers, better caregivers. And if we lose everybody, oh my goodness, I can't even imagine. I mean, we can't even think about that. Let's continue this discussion. Have you, in regards to the vaccination, what are some of the reasons why you all chose to get vaccinated?
I guess I'll go first. We got vaccinated as soon as it became available. I don't know if every ED around moved the wall 7 times inside their building because they couldn't close a zone or go completely red in your building, or lose 9 residents that you loved at the time of the pandemic hit. We're a smaller building, so 9 still a high number to lose. But my DNS and myself moved the wall 7 times. And so therefore, as soon as it became available, we led our department heads, and all our department heads were vaccinated before the end of January. So It trickled down, and that's where we educated, and my IP nurse was amazing and educated herself, educated the staff. We all educated everybody. And so we're down to 10 people. So our building, our small, 10 people, still a lot for us. We're losing a gamut of everybody, but the education that went along with it throughout the whole process, and new hires and educating them when they're absolutely against it, has been amazing. That the education part can get it turned around.
You know, Richie, I didn't know that you were a police officer before taking this role. So you've dedicated your career to serving people. Thank you for your service.
Thank you, sir.
So let's go around the room. Let's start with you, Brandon. Why did you get vaccinated?
I got vaccinated because of where I work. That was really the only reason. So being a younger, ED and somebody who's healthy, and I wasn't really worried about getting COVID myself. But I did go last December as soon as I could, and got vaccinated for our residents just because. Up, and it was locked off, and we couldn't go see those people. So like I said, it was still pretty fresh then, and I just wanted to make sure I did the right thing for our residents, for sure.
Okay. Leslie?
So I remember when we received news that the vaccine was available, and I literally was in my kitchen and I started crying because we were in the middle of having an outbreak, our first outbreak, and fortunately, knock on wood, the only outbreak so far. And yeah, my kids were there, and I literally started crying because I just felt like it was maybe the end to this new way of life we've been living. And so immediately, just like the others said, I became vaccinated, and all the managers became vaccinated as well. And we just thought, we have to lead by example for our facility to do the right thing for our residents, and, not just for our residents, but our community or our family, all those things. And so that's why I chose to get vaccinated.
Thank you. When we started talking about the vaccination at Greenwood Meadows, it was kind of hot and cold. And I'll never forget speaking with one of our housekeeping professionals, and she was in tears. And she was in tears because she didn't know whether the decision was right or wrong. She's a single mom. She was responsible for providing for her children. And it was just a huge decision. And for me, I'm thinking through it as I'm speaking to her, and I had to realize that I must honor what her thought process is. But in the same breath, I may be able to shed some light from my own perspective. And that's a fine line, because the last thing we want to do in this era of being told what to do is really be overstating, if you will. But in the same breath, what do you do when you have residents that are really dependent upon the care of others? Anybody want to speak to that? The care for others, speaking to the care for others in your role.
Well, I'll speak to that, Jerald. So for me, when I got vaccinated, I was excited about it as well and could not wait to get vaccinated. And I have had in my experience at least one resident that could not be vaccinated due to underlying health conditions. And I remember having a conversation with their loved ones who were not vaccinated about creating a safer bubble or area donut around the resident. If everybody else could be vaccinated and create this safer bubble around their loved one, wouldn't that be great for the resident that doesn't have the option because they really cannot have the vaccination? So that's one thing that resonated with me, is kind of creating a safer bubble around our residents and in our space.
And let me ask you, is that safer bubble? I know that each of you are called to serve in this space, but has the urgency risen as a result of leading through the past 2 years when we think about protecting those in which we serve and those that we serve alongside? Can someone speak to that?
Yeah, I can talk about that, I think. So the urgency around caring for our residents, especially when we were going through COVID, I think everybody was celebrated as heroes, and they were, and we're so grateful for them. And as that relates to the vaccine, I just want to talk about that. I've been thinking about this a lot, and we celebrated those folks for taking care of our most vulnerable residents when they were extremely sick with COVID. And they were heroes, and we all appreciated that, but nobody forced them to do that. They made a decision to do that because it was the right thing to do, and they were called to serve for their career. And I think if we kind of took that same energy and put it toward this vaccine mandate, this vaccine decision that we all have, I think if we all made that decision like we did then to care for these folks, if we made the decision to get vaccinated to protect them, I think if we took that same energy and applied it to this situation, it would go a long way.
Thank you for that comment. We were at community nursing and rehab. I was there with Jessica and with Edna, their ED, and a nurse had said, he said he was vaccinated, but he went on to say his heart broke because he knows what he and his peers in the nursing community did throughout this pandemic, which is still going on, but he was referring to when he worked exclusively on a COVID unit. And he said, so are they not heroes anymore if they choose not to get vaccinated? And that was a very strong point, because absolutely, yes, they are still heroes. Your families are still heroes. The people who stayed at home and allow you all to go to work, allow me, myself, to go to work when they were sheltering in place at home. That's a huge commitment. That's a huge contribution to this world. So for those out there who may be on the fence, this doesn't compromise your contribution to this cause. You have showed up. You have come when many were afraid to do so. But what we want you to know is that we really still need you. We really still need you. And we need you to make that decision, and we need to honor your decision. But at the end of the day, guidelines or not, it's still ultimately your choice. So I would ask you to just frame in your mind, if you do decide to do it, that you stand firm in saying, yes, I'm going to do it, but it's my choice. And I'm going to do it for this reason. Would anybody like to add to that? Okay. So this is a little interesting for those that are out there watching. This is unscripted. We did not practice we had a few mix-ups because I have a difficult time managing the Zoom platform. But this is straight from the people to the people. And so no hidden message. We just want to reach out and say thank you. Thank you for everything that you have done for our residents, for our organization. As we approach these deadlines, let's just go around the room. As we approach the CMS deadline for having documentation on the vaccination of our professionals within our communities, what's keeping you up at night, Leslie? What's keeping you up at night in regards to that?
Definitely. Again, staffing. We need these people. We desperately need these people. The residents need these people. These staff members, they need the care that they provide, and we need them. All of us need them.
Absolutely. Brandon?
I would echo those same sentiments. I mean, I know we've got especially a couple, staff members that are really our top-notch employees, and they truly are at our facility for the right reasons. And I would hate to see them go. So,
Katie?
The same. Truly, staffing and the fear of the unknown and what's to come. So just really praying that we can maintain our staffing and maybe change some minds, perhaps.
And Richie?
I don't want to lose good people to this. I mean, that's what it comes down to. They're caring people. They wouldn't have came into the industry to begin with. They came to take care of people, whether it's our housekeepers, our culinary staff. I mean, it's like I said, the whole gamut. So we need all of them. We definitely need them to stay. I don't know how to get that done right now. We're still working on it and trying to get it daily after day after day after day, preaching to them, not preaching, but basically trying to educate and get them to stay on board, because they are caring people.
Caring people. So it's interesting how we care for people and we depend upon caring people to care for people. I think about the counties that we represent throughout the country. We have some urban counties, we have some rural counties. I think about the distance between one community and another. And what if we didn't have the acceptable amount of staff? What type of challenge would that pose? And we aren't just going to sit there and allow it to just fall to pieces. We'll have to make some critical decisions that may involve trying to move residents somewhere else. I don't know. I can't speak for that right now, but I think about it because for many of our communities, really for all of our communities, this is home. And not only is it home in a familiar environmental surrounding, but it's home in a loving and emotional surrounding. These are people that we live with each and every day. We laugh with them, we cry with them, we fuss sometimes, or they fuss with us. I can't tell you how many spankings I got from residents. It's just emotional spanking, like I'm gonna get you. But we love them. We love them. And we want to continue to provide the best that we can for them. So we're going to end this up, and I just want to thank you all. I asked the executive directors if they wouldn't mind showing this video. We want to thank those that have considered this. We want to thank you for reconsidering. But most of all, we want to thank each and every one of you for showing up on the battlefield each and every day, for giving your all. We need you. As we say at the building level, there is no one ever bigger than the building. This is a team approach. We need each other. That's the only way we can continue to advance senior healthcare. So for all those listeners out there, thank you. Thank you for considering. And if you wouldn't mind, go on social media if you decide to do it. And hashtag I did it my choice. Hashtag I did it my choice. You still own this decision, and you still have the ability to gift those that you impact each and every day. On behalf of our leaders on this Zoom recording, thank you all. Have a great day, and we truly appreciate you. We are one ASC.